So the difference between being on YouTube versus here, you want to stay here if you would like to speak during the hearing. So if you would like to speak to the panel, the traditional rules of testimony apply, 3-minute statement, and then receive questions from the committee. If members of the committee have questions, then you should stay in this meeting. If you do not wish to speak orally and wish only to observe, then I encourage you to exit the Zoom meeting and join YouTube, because that will reduce the amount of confusion in terms of who's here to speak. But if you did want to speak, that's 100% okay. Stay right in the Zoom, and IT will be going through the list one by one and unmuting and activating the video of each speaker, everyone who's an attendee in the meeting. We have quite a list, which is really exciting. We have over 30 people who signed up to testify today. Okay, I'm Senator Shenna Bellows, Chair of the Universal Basic Income Committee. We are now live on the web on YouTube. We are just waiting for the co-chair, Representative Jim Handy, who's awaiting the new invitation. And yes, if you are watching at home and you submitted written testimony to Karen Naidu, then we, the members of the committee, have that. In fact, I was reading some of that testimony this morning. I'm really grateful for people who sent testimony in ahead of time. So we're just waiting for Representative Bradstreet and Representative Handy. And when they have joined us, they are members of the committee who represent the legislature on the committee. When they have joined us, we'll be starting. Again, for folks watching at home, this is the committee to study the feasibility of creating basic income security. And you can see materials that have been submitted to this committee, both testimony in writing from Diane Clark, Larry Danziger, Evelyn Forget, Ginny Schneider, and Carol Wishcamper on the legislature's website, which is legislature.maine.gov/basic-income-security-study. And on that website, you can find testimony that has been submitted to the committee for today's meeting. You can also find testimony that was submitted to the committee last November 22nd, 2019, as well as information that was presented by Professor Ronald Heichel in a report out of the province of Manitoba. We are waiting for a couple of representatives who serve on the committee to join us before we get started with this committee's work today in taking public testimony. And if you submitted testimony in writing and it's not on the website, it will be posted on the website over the next week. Okay, Representative Bradstreet is here. We're just waiting on Representative Handy. In terms of the format of today's hearing, we'll be having members of the committee introduce themselves and who they represent. And then we will welcome testimony from the public. This is the committee's opportunity to learn and listen. We will are invited to ask questions of people who testify to really understand and learn about the topic. But our opportunity to discuss amongst ourselves how we want to proceed is something that we will do at our subsequent meeting on October 29th. Okay, I think we're all here. Representative Handy is in. Welcome. So I'm Senator Shanna Bellows, and I'm the Senate Chair for the Committee to Study the Feasibility of Universal Basic Income. It is a pleasure to be with you here today. I represent Kennebec County, Senate District 14, which includes the towns of Chelsea, Randolph, Pittston, Gardner, West Gardner, Farmingdale, Hallowell, Manchester, Reedfield, Winthrop, and Monmouth. And we're going to go through members of the committee one at a time to introduce yourselves and who you represent and where you live. And then we will go into accepting public testimony. So Representative Handy, as the co-chair, would you like to go next?
I would. Good morning, everyone. Jim Handy, representing part of the city of Lewiston, he, him, his. And I look forward to working with you all once again.
Thank you. Tracy Bellinger.
I'm Tracy Bellinger. I'm the labor representative. I work with the National Association of Letter Carriers. I'm a letter carrier in Portland, Maine. I'm happy to be here again, and I am she, her, and hers.
Is Senator Matt Pouliot with us? He represents the Senate as well on this committee. I don't see him. Okay. Senator Moore.
Good morning. I was just trying to get the sunshine from shining so brightly on my face here. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Sullivan, and Winter Harbor in Hancock County as well.
Thank you. Next is Samarali Daniels.
Oh, hold on, pop my video on. Hi, I'm Samara Lee Daniels. I use she, her, hers, and I represent impacted folk in the state of Maine who are dealing with poverty.
Thank you. Sass Linnekin.
I am Sass Linnekin. I use they, them pronouns. I also represent somebody with experience of impacts of poverty, having been chronically homeless for years. And I also now work with resources for organizing and social change.
Thank you. Representative Bradstreet. Oh, Representative Bradstreet, it may be that you were in the attendees list instead of the panelist list. And this happened to Representative Handy as well. There were two separate links that were sent out. You may have joined the link that was for attendees. So what I'm going to ask Anthony Tassaneri, who is the host, is to resend you the proper link that's specific to you that will make you the panelist, and will return to you once you're able to join. So what you should do is leave Zoom, check your legislative email, and use the link sent to you by Anthony. And, oh, take that back. Anthony has magic powers and you've been promoted. So, Representative Bradstreet, are you here? You can start your video. And, oh, good.
Good morning. I don't see my
There you are.
face up there, but I'm Representative Dick Bradstreet. I represent House District 80. That's comprised of my hometown of Vassalboro, Windsor, Somerville, and part of Augusta.
Thank you. Representative Meyer.
Good morning. I am Representative Michelle Meyer. serving Southern Maine's House District 2, which is Elliott and parts of Kittery and South Berwick. She, her, hers.
Thank you. Professor Michael Howard.
Michael Howard. I'm professor of philosophy at the University of Maine. I'm on the committee representing higher education. I also do research on basic income. I'm head of a national organization called the U.S. Basic Income Guarantee Network, and a co-editor of the journal Basic Income Studies.
Thank you. I know Karen Anderson had intended to be here today. I don't see her name in the chat. Anthony, do you want to check and make sure that she's not in the attendees list and promote her if she is? Again, her name is Karen, Karin Anderson. Okay. If Karen is able to join us later, we will have her introduce herself at that time. That completes the members of the committee. I would just also like to welcome Karen Nadu and Deirdre Schneider. If you'd like to introduce yourselves briefly so that people can put a face and voice to the name on the email.
Hi, my name's Karen Netto. I'm sorry, I have my laptop set up. I wasn't prepared for this. I work for the Office of Policy and Legal Analysis, and I typically staff agriculture, conservation, and forestry, and co-staff education. But I'll be working with you and have been working with you on the basic income security study. So if you have any questions, just contact me anytime. Thanks.
Thank you. Sorry to surprise you this morning, but we are so grateful for your hard work in getting us organized and sending out the timely communications. And Deirdre Schneider.
Hi, I'm Deirdre Schneider. I obviously also work with the Office of Policy and Legal Analysis, and I'm co-staff with Karen on this study. And during the session, I staff Labor and Housing Committee and Marine Resources.
Wonderful. So I think we're ready to begin, and thank you all for your patience with this format. We wanted to ensure everyone's safety, and Zoom felt like a way that we could include the public and also have an important conversation. This is an overdue conversation. We, under the rules, we're not allowed to meet during the legislative session. Well, not allowed to have staff during the legislative session, and staff is really important to the work of this committee. But want to thank everyone's patience, and we have scheduled, this will be the first of 3 meetings that we will be having before December, with a goal of producing a report to the next legislature. Today's meeting is to hear from the public their views on the feasibility of universal basic income. And so we have a list of people who have signed up to participate, and IT will, one at a time, unmute them and allow them into the chat. If someone is not present, we'll absolutely go back to them. They will not miss their turn if they didn't get on the Zoom in time or were confused by some of our delays and deliberations. And a question for IT, I don't know the answer to this, but can people sign up during the day if they realize that they did want to speak but are somehow not in the attendees list of the Zoom, if they're on YouTube? Is that something that is possible? We'll find out the answer to that and get back to everybody. But we're going to start, and we're doing this in alphabetical order by first name, with Amanda Richards as the first person who signed up to speak. Is Amanda present? Okay. I'm not seeing Amanda Richards. If Amanda joins at a later time, we absolutely will hear from her. Anne Danforth is second on our list. And for those of you who are watching on YouTube and interested in speaking, what you would need to do is email the committee analyst. It is Karen, Karen .Nadu, NADEAU @legislature.maine.gov. and in order to get an attendee link to this meeting and to be added to the list. To become someone who testifies, you must be on the Zoom. So if you are hoping to speak today, you need to follow the link that was emailed to you when you reached out to sign up to speak with Karen Nadeau. So you must be in the Zoom in order to speak. You can't speak from the YouTube. But we'll begin. I see that Ann Danforth is an attendee in the Zoom, and we will promote her to panelist and have her deliver her 3 minutes of remarks. We ask that those who speak limit your remarks to about 3 minutes. We're not timekeeping, so if you go a little over, it's okay, but I will be watching the clock. If it gets into 5 to 10 minutes, I will cut you off just to make time available for others. Please start by stating your name and your place of residence and any organizational affiliation very clearly, and then delivering your remarks. Committee members, once the panelists have spoken, of course, you can ask any questions that you like. It would be wonderful if you could use the raise hand function that is in the chat so that I can recognize you, so that we're not peppering the panelists with questions all at the same time. So welcome, Ann.
Hey, good afternoon, Senator Bellows, Representative Handy, and members of the committee to study the feasibility of creating basic income security. My name is Ann Danforth. I'm a resident of Portland, and I am a policy advocate at Maine Equal Justice. We're a civil legal services organization, and we work with and for people with low income seeking solutions to poverty through policy, education, and legal representation. And we're so heartened that this committee is looking closely at how to achieve income security for all Mainers, especially at a time when COVID-19 is shining a spotlight on the deep racial and economic inequities in our state. COVID-19 has made it all too clear that our economy and governmental systems are failing many low-income Mainers, particularly those from Black, Indigenous, and communities of color. Even before the pandemic, Mainers were struggling to meet their most basic needs. While 10.9% of Mainers, or just over 1 in 10, experienced poverty in 2019, this picture is now much more dire. Most recently, just to give a snapshot, the Census Bureau's Household Pulse survey data indicated that over the month of September, 25% of Mainers experienced difficulty covering usual household expenses. At the same time that COVID has exposed the gaps in the existing safety net, we've also been able to see firsthand the impact that extra cash assistance has made on the financial health and well-being of families. Every indicator is that the no strings attached income provided directly to low-income households in the form of stimulus payments and increased unemployment benefits were spent on basic necessities. And it is clear that getting more income to people should be a permanent policy solution, not just a short-term response. Maine Equal Justice has been working with people directly impacted by poverty, as well as advocates and other stakeholders, to begin to build a shared vision for achieving economic security for everyone in the state. Based on early conversations and feedback, we have coalesced around the need for income supports in the form of cash that do not come with restrictions on how they can be spent or requirements on what people need to do to receive them. Income solutions should target racial and economic inequalities, including the wealth gap that gets in disparities in assets and net worth. Support should be provided based on level of need, and the amount of income provided should be targeted to provide the most income to the people with the most need. And it should be available to everyone residing in Maine who needs it, including immigrants who are currently left out. And it should be easily accessible and not require people to jump through hoops to access it. Research, and importantly, people in poverty, say that cash is the most direct and effective way to provide financial stability to people who need it. Experiments with basic income indicate it improves people's well-being and helps with finding work. Providing cash payments to people is also an effective way of stimulating the economy, particularly important now. Studies of cash transfer programs show that they, unsurprisingly, reduce poverty, increase funds for savings and investments, provide needed support to cover basic needs, boost health outcomes for infants, children, and mothers, improve educational attainment for children, have little effect on number of hours worked, In addition, initial results from a recent Canadian study indicated that providing cash to people experiencing homelessness enabled them to move into stable housing faster and spend fewer days homeless. And the findings outlined above are borne out by how people spent their stimulus payments, an extra $600 in unemployment insurance. For example, Joan Willow is someone who shared her experience with Maine Equal Justice, who was able to buy new glasses for the first time in 10 years with her stimulus payment. As we work towards longer term solutions, there are also ways to get more cash to people now by improving existing safety net programs, doing things like increasing benefit amounts, reducing barriers to enrollment, reducing program requirements, and conducting outreach to potentially eligible people. And these are not just important for traditional safety net programs like TANF and SNAP or general assistance. They're also necessary for programs like unemployment insurance, where only 1 in 4 potential beneficiaries receive benefits, and tax credit programs like the Property Tax Fairness Credit, which is only utilized by 28% of eligible non-filing renters. And so in conclusion, I would just urge folks to consider some of the state level solutions like these that can move us towards this longer term vision with minimal impact on the state's receipt of federal funds and with minimal negative impact on people's eligibility for other benefits, but also move us closer to this longer term vision that will really lift people out of poverty, help lift them out of poverty and shrink economic inequality.
Representative Handy, you have a question, I see, for Anne. And again, if you go to the chat and you look at the list of panelists, you can raise the hand by clicking. So if you, not the chat, but if you go to the list of participants, then you'll get under the list of participants, there'll be 3 buttons. One says invite, one says mute me, and one says raise your hand. And you can raise your hand that way if you're interested in asking questions of Ann Danforth.
Thank you, Senator. Ms. Danforth, you cited an example where someone who's given a cash payment is able to find housing. Is it a cash payment or just a term of art, or do you mean like a housing voucher?
I think what's unique about this example is that it was cash specifically, as opposed to a housing voucher. And so I think that it's meaningful that it was cash assistance as opposed to a voucher, because I think that the unrestricted nature of cash is really important in giving people the dignity and trust that feels really important.
Thank you.
Thanks for that question.
I want to permit Karen Anderson, who's joined us, to introduce herself. Karen, if you'd like to unmute yourself and show your video, I do, as a member of the Universal Basic Income Committee, I'd love to allow you to do that.
Thank you, Shenna, and I apologize for arriving late. I had another meeting that ran long this morning, but I'm really excited to be hearing the testimony today. I've been reading everything as it's been sent to us. I sadly missed our first meeting, so I'm hoping after today I will feel very caught up.
Thank you and welcome.
Thank you.
Do any other, oh, yep. Samara Lee Daniels has a question. Go ahead.
And you mentioned some of these restrictions that are barriers. Can you give some examples of the restrictions that we could recommend loosening?
Yeah, I think everything from on a spectrum of like making the application, the DHHS application system itself, My Main Connection, easier to access for people is like one side of the spectrum. And then I think barriers in terms of expanding eligibility and making fewer like recertification periods and having people have to send in burdensome paperwork. I think that those are some of the few, that there are many more than that, but just to give a few examples.
Other questions from members of the committee? If you're having difficulty doing the raise the hand function at this time, you could unmute yourself and ask your question. Or you can message me in the chat and I can recognize you. Okay. And I have a question that's something that I've been grappling with. So we're looking at just some really difficult budget decisions in the year to come and some significant revenue shortfalls. And so I think one of the questions, you mentioned in your testimony that when the supplemental benefit from the federal government ran out at the end of July, that there were dramatic increases in applications for temporary assistance for needy families and for food assistance and for housing vouchers. And I find that not surprising, but certainly alarming in terms of that transition. And so my question is this: I think there's a philosophical debate around the concept of universal basic income about whether universal basic income should be a supplement or an addition to programs that are currently available or a replacement. And any recommendations that you have for us as a committee and also for the next legislature, if we want to pursue if we want to pursue a universal basic income, should that be a replacement program or a supplemental program to to the benefits that we already have?
Yeah, I would strongly argue that at least now it should be in addition to and in no way replacing the existing benefits, in that it should be kind of a do no harm approach, and that no one should be worse off because of additional benefits. And I would also say that in terms of thinking about the shortfall and just budget considerations, I think that there's a strong argument to be made about the cost savings that arise from making sure that everyone is able to meet their basic needs in the long term, and thinking about savings in healthcare, savings from homeless shelters, which I cited in terms of people with additional cash assistance being less likely to use homeless shelters. So I feel like there are lots of good reasons that investments should be made now in looking at longer term savings.
A follow-up to that, are you aware, has anyone done any sort of comprehensive analysis of the costs of some of our state programs and the costs of a viable universal basic income program for Mainers?
That's a great question, and I can't think of any off the top of my head, but I would also be curious in seeing those. So I will take a look and would welcome if there's anyone else on the panel who does know of those. I would very much love to look at those, and if I find any, we'll share them with you all.
Okay. Any other members of the committee have any questions for Anne?
I had a question about, so you mentioned right now adding it is supplementary to our existing programs. Do you think long-term that will make it harder to reduce the funding or kind of the overall arch of our existing programs if we start giving people money on top of those programs? Or do you think it'll kind of show like what programs are less necessary because they'll be less utilized? I'm just curious, like, what you think doing, like adding them now versus totally replace them, like what would be the difference?
Yeah, that's a really good point. I'm trying to think through the difference in terms of what it would show in terms of people's utilization of the existing programs. I guess the way I think about it is wanting to to build on what we already have in a way that moves us towards this longer term vision that we want to get to, and recognizing that because Maine receives a lot in federal supports for programs like TANF and SNAP, that we may not want to give that up right now. And so wanting to build on those existing programs, but in a way that moves us forward instead of takes us backwards. And I think it would be wonderful if one day we get to a place where we have some bigger solution. But I think that right now, as we build towards that, we can take advantage of some of the existing programs that are out there.
I believe Summer Arley has a question.
Yes, and do you happen to know how effective our current programs have been over like the past 5 years at reducing poverty?
Yeah.
Good.
No, that's a great question. And I don't have the numbers off the top of my head, but I would happily share those with you all in a follow-up email. I do know that the programs have been beneficial, but I also know that there are ways in which they can be greatly improved to even more reduce poverty than what they already are doing. But I will follow up with you summarily, because that's a great question.
Would you also include in that follow-up the breakdown in racial statistics? I noticed you put 1 in 10, but I know that is very vastly different among race lines. Do you happen to know what it is for white folk as opposed to Black folk?
The most recent census data for Maine has not yet provided us with race and ethnic breakdowns. So I think that will come out in the next few months, but I can definitely look at the breakdown for the previous year and how that compares.
Thank you.
Anne, are you aware of what's happening at the federal level and whether there, obviously universal basic income has been much discussed, and there was the benefit that was distributed in the spring. But has legislation been introduced? Is legislation being drafted? And what is the role for the states vis-a-vis the feds with a program like this?
I do know that following the stimulus payment legislation included in the CARES Act, that there have been bills put forward that would provide some kind of ongoing payments like the stimulus payments, in including indicators when they would stop, like when the economy recovers. So I know that there have been introductions, but I don't know that those have gone. I don't believe those have gone anywhere. So I think in terms of the state's role, it's continuing to make the case at the federal level, but also thinking about what we can do here at the state level to get supports like those to people, because we've seen how successful the stimulus payments have been and what a difference they've made in the lives of Mainers. So thinking about how we can both encourage the feds to continue doing that, and then also what can be done at the state level to get support to people, given that it seems like Congress may take their time in acting.
Yeah. Thank you. Do any other committee members have any further questions for Anne? I don't see any hands raised in the participant list, but if you would like to unmute yourself, you have an opportunity to do so right now. Although we do also have other people planning to speak. Okay, seeing no questions, Anne, thank you for your time and your testimony. And I know you've also submitted that in writing, which is very helpful. People can do both. You can submit your testimony in writing, but also read that testimony into the record for this committee so that we can ask you questions and have a dialogue. The next person on our list, and Amanda Richards wanted just the public to know that she signed up to observe, but hadn't intended to testify. And there may, in fact, as I go through this list, there may be other people in that situation. So I know Amanda is paying close attention to what's happening today, but is not planning to testify. The next person on the list was Anna Gallagher. Is Anna Gallagher with us? I don't see her. Next was Kate Vaughn. And there is one call-in listener, and perhaps if the call-in listener could indicate in the chat your name so that we can make sure not to skip over you. I don't see Kate Vaughn. And of course, people can absolutely join a little bit later today. Just because you came early in the alphabet doesn't mean you lose your chance. Kate Blackford. Okay. Cheryl Timberlake, I do see in the chat. Cheryl, would you like to speak? Cheryl, you're now a panelist if you'd like to speak. If you'd rather not, you can indicate so in the chat. Thank you to members of the public for their patience with all of our technical challenges. This is the first Zoom meeting I've ever chaired. I think it's probably the first, no, not the first Zoom meeting I've chaired, but the first legislative Zoom meeting I've chaired. Okay, Cheryl Timberlake will not be testifying, but is here to listen and observe. Next, we have Craig Lapine. If you're in the attendee list and you'll not be testifying, go ahead and put that in the chat, as at least one person has done. Craig, if you'd like to speak, feel free to unmute yourself and activate your video.
Let's see. I think I did that.
You did. Welcome.
Thanks. And thank you, Senator. I don't have testimony per se. My name's Craig Lapine. I work for the Department of Agriculture, Conservation, and Forestry as a special assistant to Commissioner Beal, and just wanted to let the panelists know we are currently stewarding work that grew out of Representative Hickman's bill LD 1159 to end hunger in Maine by 2030. And that project quickly pivoted when the advisory group to that project from becoming an anti-hunger project per se to really an anti-poverty initiative. The work of the advisory group got interrupted by the pandemic, and we are only returning to our work tomorrow after a 7-month hiatus. But I just wanted to make the panel aware of our existence to say that I can see in terms of policy recommendations that are already bubbling along in the advisory group's interim report that there may be an opportunity to make common cause. So I just wanted to introduce that work and let you know that it's happening at DACF and that perhaps there may be opportunities for collaboration down the road.
Thank you, Craig. Very much appreciated. I know I have been really interested in the issue of hunger and universal access to school meals. Maine received a federal waiver that now extends universal access to free meals through December of 2021. So every child in Maine can access a free lunch, and if their school has breakfast as well. There's still the application process. Families have to complete the application in order to qualify for that. So, but it is certainly making a difference in some families and some communities, just knowing that that's universal.
I'm happy to let you know that the waiver was just extended to the end of the school year. So we just got word from the USDA that those waivers don't extend just to the end of the calendar year, but to the end of the school year.
Yeah, and I think, don't they extend it to December 2021 to next fall as well? I might have misread the notice.
Oh, you could be right. I don't know. But certainly through June.
Yes, which is really exciting. It's really important. And I'd like to see that be something that we find a way to make permanent. But are there other questions for Craig? Thank you for letting us know that this group exists and is working on policy solutions that are anti-hunger and anti-poverty. Questions from members of the committee? And Craig, are these meetings something that members of our committee could listen in on or review after the fact? Is it similarly going to be open to the public on Zoom or YouTube?
It has not yet been kind of adjudged a public process because of the way the advisory group was formed. However, I will say that the first advisory group meeting since the pandemic is happening from 2 to 3:30 tomorrow via a Teams meeting, and I would be more than happy to share that invitation. Perhaps I could share it with Karen, and if she wanted to share it then with members of the panel, that would be fine.
That would be great. Thank you. Samarali?
Has there been anything that you've learned throughout your process so far that's that might be pertinent to us? Like, have you looked at any replacement programs or putting in any new programs for food and hunger?
Well, I will say that, we are behind you in our process in terms of the research that's happened, although we're really mostly drawing on existing data. We're not doing a lot of new research. But I would say that, as Ann Danforth mentioned, I mean, cash payments do seem to be the single, poverty is what causes hunger. Cash payments do seem to be one of the most effective means of addressing poverty. But I don't know that we have access to information that you haven't also come upon.
Thank you.
Are there any other questions for members of the committee? Feel free to unmute yourself if you're uncomfortable with the hand function in the panelist list. Okay, seeing none. Craig, thank you so much. We really appreciate that you took the time to listen in on what we're doing. We don't feel that far ahead. We too experience pandemic-related delays, but we appreciate that your group is doing this work and also that you're willing to make sure that it's not happening in silos. I think is really spot on. So thank you very much. The next person on the list, although I don't know that I see this person in the attendees list, is Danielle Blair. Okay. And then Don Croto. No, I don't see Don as well. D. Clark, I do see. So D. Clark is in the attendees list and will be made a participant so that Dee may testify to the group. And Dee, if you could share the comment as well that you made in the chat so that folks watching on YouTube can see that, that would be great.
Sure. The last gentleman answered about other programs for food, and his answer was cash was the better answer to poverty. And I'm saying right on, because that is the better answer. Just have cash and choose how you spend it. Thank you.
Great. And Dee, do you want to introduce where you're from, your name and where you're from? And then are there any other comments that you'd like to share with the committee?
Sure. My name's Dee Clark. My birth name is Diane Clark. And I'm 63 years old. I'm from Portland, Maine. I grew up in poverty. And as an impacted person, I often say, well, what does that mean? It means I grew up and survived poverty for 63 years as a child, as a teen, as a mom. I'm grateful for this committee. I hope you come up with good answers. And keeping people's dignity in place really makes a difference. And we've gone through the food stamp era to the EBT cards just to help people feel more like everybody else. But this is crucial, even before COVID, is to be able to choose how I live my life is based on poverty. What will I have access today? What will I have access to for my children? Is based on poverty. What can I find free to do, like in a library, but it really limits. Maybe I want to pay for my child to learn ice skating or something like those things. So it isn't just, getting basic needs met, it's being part of a community and feeling a part of a community, and cash does help that. I'm here to say anything for anybody about poverty because I believe that's who the experts are those who are surviving in it.
Thank you, Dee. Ann Danforth spoke a little bit about barriers to some of the programs that are accessible to people living in poverty. Can you speak, are there any examples that come to mind when you hear the word barriers as this committee thinks about any recommendations to the next legislature in terms of removing barriers?
Well, one major barrier is, and I'm not a math genius, but it seems like when you're talking to the city like GA or talking to someone in TNF or EBT cards or even SSI, which is not the same as SDI, there seems to be a formula that has a cap that equals the amount of money of any sorts that that person in poverty can access. So for some reason, if one is helping you, one organization, TANF or someone is helping you, and you have food stamps, whatever that total income is, that's considered part of your income. So maybe you won't get something else somewhere because you're only allowed as a single person, as a mother, as a person with 3, whatever, a certain amount. Like they need to get rid of the cap. They need to get rid of that ceiling. Poverty is poverty. No one's getting over. No one's getting past poverty, even with the assistance that I'm always grateful for. And here I am again exposing myself of living in poverty and having to beg to get a food box at my age.
Yeah.
But that's a barrier right there, whatever that cap is.
Sass Lincoln has a question.
Hi, Dee. Thank you for your testimony. I got a chance to read it this morning, and I was just wondering if you would be comfortable speaking a little bit. You were talking about the amount of money that you live off a month and said that for a single person, it would be a lot more doable for you for your survival if you were making, say, $400 or $500 more than what you're taking in now. And I was wondering if you were comfortable talking at all about some of the things you feel like you're going without because you don't have a living amount of money.
Well, right. So unfortunately, I still need food boxes. And it's a little humiliating. And I'm grateful that they'll deliver them to me because of COVID. But, people see someone coming in and bringing me a box. By now, we should not care. Neighbors should be neighbors. But still, I'd rather go buy my own food, and not hope that they'll bring me something that I eat and like, because I have received food that I don't eat and I can share it. But just to be able to have that basic choice and feel good this morning, because I have choices. My choices are limited. I have to be able to afford my rent. And I'm fortunate. I live in a tax credit apartment. So just that said, it's a decent looking apartment. And I have Section 8. If I didn't have the Section 8, I would not be able to afford this tax credit because even that isn't low enough. But because I have the Section 8 and I pay 50% of my income, because now Section 8, you started off, you can pay 30. Then they went up to 40 and now they're going up to 50. So people can stay in their homes or find decent places to live. But 50% of my income goes to that. And then people in poverty, we do drive cars sometimes. And I've had my ups and downs with having clunkers or not so bad cars. And never mind the upkeep, is if you get it on the road, then you have insurance you have to have insurance. So you have to choose, do I pay my insurance this month? If I don't pay it and I get pulled over, I'm gonna be in a lot more trouble because I've done that, I've experienced that. So the barriers are, you can't just say, this person or this family, this is as much as you can have. Oh, but yes, of course, work. I've worked all my life as a mom, every kind of freaking job there is. And, but then those dollars are counted in. So you don't really ever get $5 or $10 more a week. You don't really get past anything. You don't get up from underneath the poverty line. But I hope that is the answer.
Thank you.
It was. Thank you so much. I wanted to just pull that out a little because I thought the last line of your testimony was really salient about this being about real life and not just paper and statistics. So thank you very much.
Thank you. And Dee's testimony is listed online under Diane Clark. So people can see that on the Universal Basic Income Study Committee's website, on the state legislature's website. Any other, yep, I see Tracy has a question.
Hi, Dee. This is all very interesting, and honestly, thank you so much for coming and talking. Also, great glasses. But I had a question just about how Section 8 works, because I don't know. When you say you pay 50% of your income, is that like an estimated income for the year, or does it change month to month with your changing income? Or is it periodical? I was just curious.
Well, you do have an annual income verification, and then they will adjust the rent. And it's supposed to be 30, but now it's 40 and 50% of your income. And then you might get a couple of credits. I can't remember what those credits are. Like LAHEAP, which is a ridiculous thing to get more food stamps. That's a formula, it's crazy. But, and every year. But for some reason in the middle of the year, if my income went down or things changed, I can report it to housing and they'll adjust it immediately. But if it increases, I still report it, but they don't do it until the following income verification time. The other benefit of Section 8 is they have housing inspectors, and other apartments don't have housing inspectors. They have a housing inspector to come in to make sure, the faucet's not leaking, you don't have a hole in the floor, those basic things. So you usually have a pretty well-kept apartment in apartment building.
Got it. Thank you.
Dee, I have a follow-up to that. I know there are significant waiting lists right now for Section 8. Did you experience a wait time when you first qualified for Section 8, or is that something that is new
Well, it's new, and I'll be honest, here I am, and I'm exposing myself, but I don't mind, because I'm telling you, it's horrible to live in poverty and have to figure it out, which I did, with always trying to come out of it. I've been on Section 8 for many, many years. I was in a shelter, and I think the apartment was, it was like, they called it something else, but it was project-based in the apartment, and it was a historical building on Munjoy Hill, and that was moving out of the shelter into that with my children. And there is where I was on the waiting list. So I already okay, because I had that, and eventually my name came up for the Section 8. That was a long time ago. It's really different. It's horrible trying to get Section 8 right now. The other thing I do, and for most of my life, I've been an advocate with Homeless Voices for Justice. And I also started a nonprofit, Survivors Speak USA, which is all about women that are coming out of prostitution. And when people hear that, they're alarmed. But believe me, there's a lot of coercion and trafficking that goes on with that. And these women, many of them are mothers, and they're dealing with the same thing. And I push and tell them, no matter what, sign up for Section 8. Because when you're in poverty and when you don't have any money and something goes wrong, it's easier to beg for 30% of what your income used to be than to beg for 100% of your rent. So at least the Section 8, or that idea of 30% of 40 or 50, having to come up with that rent when something goes wrong. is not as bad as coming up with the whole 100%. Yeah, but it's a long wait.
Thank you very much. Do any other members have questions for Dee? And Dee, to your point about exposing yourself, thank you for sharing your story. It really helps the committee understand what we're talking about, but I recognize that it takes courage and it entails some personal risk for you. So
It does, but today I'm very transparent, and hopefully something will shift, hopefully.
That's how we make change. Are there any other questions for Dee Clark? Okay. Samara Lee, did you have another question?
Yes, Dee, I wanted to ask, you mentioned the income cap as, that major barrier. Are there any other barriers that you see that have been reoccurring throughout your interactions with the systems that we can address or look at?
Well, first I'll tell you, my children are all adults and gone off with their happy lives. Hallelujah, that happened. And the women in my life today are from Survivor Speak or from Homeless Voices for Justice, were also mothers. And one of the big barriers are, when I did go to programs that were either like to learn a trade or some certificate program, childcare was really difficult. Today, childcare is really difficult. Just for women to come to our programs, we pay their babysitters, but we don't offer childcare, and they can't find childcare. And getting a voucher to get into childcare is really difficult too. So for a young mom or a middle-aged mom, doesn't matter, but trying to do something different to try to crawl out of that or scratch out of that poverty, if you don't have access to childcare that you feel safe and good about, you can't get anywhere. And trying to get a babysitter that usually, which was my problem, I see this happening right now, is somebody will say they'll babysit for the person, but they don't want it to be reported. But the person paying the babysitter wants to report it because maybe housing or maybe TANF will, count that as a spent income, a spent money that's, important and it's lost. And they'll try to make up for it. But then that mom is on the same state aid and she doesn't report that because she thinks she's getting a few extra pennies and then she gets in trouble. Did you hear my point? So free child care or some kind of extra vouchers would be really good. Or let moms in poverty babysit other people's kids without penalizing them and counting that as more income. Transportation is always a big deal. TNF, DHS moving out to where they move, even though they put a bus in place, that was huge. I mean, it's just hard to get around. But then people who lived far away had to get there too. So someone mentioned it. There's, as well as the annual verification for housing, you have to do that for EBT. And sometimes they do it for 6 months or a year, depending on where you are. I think disability, it's a year, but some people it's 6 months. And they send it out and, you can do it online, but you have to be really good online. And I couldn't do it. This year, I tried and I ended up getting someone to help me on the phone from DHS. I filled it out. It was a done thing. I make a call when I'm supposed to call for my interview. They said they don't have it. No, first they said, yes, we see you did it on time. Thank you for putting your paperwork in on time. Oh, but we need proof of income. So I'm still not ready. So I have to get proof of income because I get a $40 stipend to volunteer for Preble Street. So I have to get that. And now I'm waiting for them to write a letter to give to them. By the time they get it, they tell me they don't know if they have it, even though Preble Street got a confirmation that they got it, because they have to do it in stacks as they come along. So now when my food stamp comes, they come not retroactive because they can't come till all the paperwork's in. So I'm waiting. And so 2 weeks go by. And so 2 weeks ago, I was supposed to receive food stamps, but I don't because they have to wait. Finally, they get it. Then I get the food stamps, but they don't give the 2 weeks that pass. There's all these little tedious things.
Thank you for sharing that experience.
I can't remember. There's something else about that, but it might come to me.
Thank you. Are there any other questions from members of the committee for Dee Clark? Okay, seeing none, thank you, Dee. We really appreciate your time. And I know Elizabeth Capone Enriquez is waiting to speak to the committee. So she will be made a panelist and brought into the meeting.
Hi, good morning, everyone.
Good morning. Welcome.
All right, let me get my camera right here. Okay, so my name's Elizabeth Capone Newton or Capone Enriquez. I live in Portland. I'm from Auburn. I am a little bit distracted at the moment because I've been spending most of the morning coordinating medical care for my partner, which is how I've spent most of the last 4 weeks. And I only got to catch the last of what Dee Clark was saying, but I can't emphasize enough how much tedious, that word tedious, really does describe how it is to interact with the systems that are meant to support poor people. I would also go, as I'm sure Dee would and many others, beyond the word tedious to like dehumanizing, demoralizing, just really what, what I, in the Poor People's Campaign, Reverend Barber talks about policy violence, which is the idea that violence doesn't just come in the form as we usually think about it, but that it also comes in the form of the policies we make and the violence those policies inflict on people. And what I think about when I think about interacting with the various programs run by the state and cities and towns to help people is I think about procedural violence, just the way that it's so hard to get what you need in a simple, straightforward way. So in that way, I would say that I'm here today to say that if there are ways that we can help people that are more straightforward and simple with fewer barriers, and it seems like universal basic income could be part of that, then that's really important. And I'm also here today to try to share a little bit, yes, of my own family's experience, but also people that I've worked with, especially since March with the pandemic, but also before then, and the challenges people have had navigating public benefits, dealing with the system, getting what they need promptly or not being able to do so. I think that it's really important that something like universal basic income is available to people, primarily because how do I put this? The stability of knowing that you will have a certain amount of money, cash, to use as you need it, can bring a lot of assurance in terms of, your situation as an individual, and for your family. So right now, as I've been navigating my partner being sick, the first thing I did was go back to full-time work because we're not sure of what his situation is going to be short, medium, and long term. Now, how do you think that feels in terms of my life and my family's life that's a financial decision that I made, right? But what does that mean? It means I'm basically working 16 hours a day because I'm working 8 hours a day coordinating his care and coordinating the requests to ask for other people to actually coordinate his care, which by the way, take time, right? So, and then I'm working 8 hours a day for pay. So yeah, like right now in terms of my own family's life, if we had universal basic income, that would make like a huge difference in terms of our quality of life. And I have to be really clear also that if it meant that we were going to lose our main care, that would not be good. Like we're like poor people, just like everybody else, regardless of our formal education, because I have plenty of that. People make, by and large, very logical, reality-based, strategic decisions about how they can meet, you know, their needs. And so if people are faced with losing their healthcare when they know that they're not going to have another way to access their healthcare, well, first of all, we shouldn't put people in that situation, right? But it would make sense that people would prioritize their access, for example, to Medicaid or main care over cash, right? Because we know that healthcare is extremely expensive and that we could die if we don't have it, right? So it's a logical decision that we would make to say, you know, I need to keep my healthcare above all else, even if that means not having enough money to pay my rent or buy food, right? Because even though we don't want anyone to be homeless, the reality is that at least you would still be alive. But if you don't have healthcare, you might not be alive anymore, right? So these are the kinds of decisions that we put, you know, 140 million poor people in the United States in every day. And I don't have the stats on Maine at the top of my head, but probably at least 500,000 people in Maine. So I don't know if there's a time limit to this because I wasn't able to join at the beginning to hear that. I don't know, Senator Bellows, if you could clarify that for me. I wanted to say a little bit about the people that I've worked with, but I'm accustomed to a 3-minute limit, so I don't know if that's at play here or not.
There is a 3-minute limit, but we also said that we really want, you know, the fact that you're taking time out with so much going on to share your experiences and the experiences of people you work with is really helpful to us. So I think if you want to share just a little bit more, I know I want to hear about the experiences of people you work with. And I'm also aware that while a number of people signed up for the Zoom meeting, not everyone was intending to speak. So I think with the committee's indulgence, I would invite you to share what you wanted to say about the people you're working with.
Thank you. Thank you, Sonali. Okay. Well, if you don't stop me, I'll keep sharing. So, like I said, I live in Portland and I'm from Auburn. And since March, I have been coordinating some mutual aid efforts. That means in a volunteer capacity, basically soliciting and receiving requests for urgent or emergent help, really from all over the state, but primarily Portland, Greater Portland, Biddeford, Lewiston, Auburn, some in the Augusta, Winthrop, Bangor, Orono area, Rockland. Those are the areas that come to mind immediately. So soliciting requests and receiving and responding to requests for urgent aid. This has included people with no place to go who are navigating applying to GA. And as you probably know, right now, GA has to reply within 24 hours. But that's actually not good enough for a place to stay that night, right? So basically assisting people with hotel rooms until their GA is approved, helping them with the GA process, because as we can imagine, people are in crisis when they have no place to go. And that's not an easy time to interact with systems and fill out applications, even when it's not a pandemic, but especially when it's a pandemic. People might not have phones, etc. Or just from a mental health perspective, it's really challenging for people. So if we had universal basic income, people would not have to go through all these, I guess I'm going to call it gymnastics, in terms of just, trying to figure out who they know that can help them and then get connected to the person who can help them. And then obviously, taking that person's time from an efficiency perspective it's not a very efficient way to do things, right? As in, if the people who needed money and don't have money actually had money, then they could get a hotel room when they needed it, right? Until their GA comes through. Or until obviously we need better options for housing in a long-term level. So housing is one example. Emergency housing is something that we worked with a lot of people on. And I would like to clarify that we were able to do this through fundraising, grassroots fundraising, and individual donors. I don't think that's the right model to use to take care of 1.3 million, people in Maine. It's not something we can scale up. Like myself, the people I work with, and the many people who do this all the time in our state to help their neighbors and friends, cannot take care of 1.3 million people, or, 500,000 who are in crisis at the same time. So I'm glad that you're considering universal basic income, because we need better solutions that cover 100% of the people in need. Aside from housing, the other kinds of emergency requests we got were for medication. So for example, again, whether it's mental health or technology or whatever the barrier is to signing up for main care and knowing how to do that, or dealing with a lapse in main care that's just basically an error, it leaves people without an ability to get their medication. And so, again, just getting calls from different places around the state for people who can't get their prescription, all different types. And that would be a way that if people had universal basic income and they were experiencing an issue for some reason with their insurance or their healthcare status, which again, they really shouldn't be, but it would be a stopgap way of getting the life-saving medicine that they need. Other forms, definitely food. Food was a huge one. And obviously we should improve and expand food stamps or SNAP, and have different food systems in general and healthier food and all of that very accessible to people. But, the reality is of the situation right now, people are without food often. And a lot of the kind of emergency support we provided was delivering food to people and delivering food in the way that they need it. So if they don't have a way to cook or etc. Again, this is something they could do for themselves if they actually had cash, right? They could just buy the food that they need if there was a problem with their food stamps, or if they're or if they don't have food stamps, right? Because they're not eligible for food stamps, but they are in need of food. Again, many ways to solve the same problems, but the reality of the inefficiency and tediousness and the mistakes, just the outright mistakes that happen all the time in terms of eligibility issues with food stamps and main care and TANF, just mean that people are left without what they need and just high and dry, as we would say. Let me see. I guess the last thing that I want to say is that I work for, I'm not here right at this moment in paid capacity, but I work for an agency that works with people of all immigration statuses. And I need to be very, very clear that just like with healthcare, if we are going to have universal basic income, it needs to be accessible to everyone who lives in the state of Maine, regardless of their immigration status or any other kind of limitation. So everyone that lives in Maine needs to have access to it. I know that what's often, people say that everything we do is either out of fear or love. And I know that when people talk about universal benefits, the fear of will thousands or millions of people descend on our country or state because we offer some kind of benefit comes up. I think from a very practical perspective, the answer is no. But also, as I'm sure you're well aware, since many of you are actually in the legislature or paying close attention to it, our state actually does have a decent amount of wealth. It's just that over many years, including recently, we've changed how much we tax rich people and companies in our state. And so we could have plenty of money to care for people, even if we were to somehow have an influx of people in need of your universal basic income. I don't think that's going to happen, but I definitely don't think scarcity is the issue. The willingness to do right by, the million people who live here who don't have a lot of income is where we need to focus our efforts. So, yeah, I think that's about it. I'm sure I've forgotten things that I wanted to say, but just it's so important for everyone to have access to this because, like I said, I work with a lot of people who do not have easy access to the benefits like unemployment and GA and TANF and things like that. And sometimes legally they actually are entitled to those things, but practically because they are so accustomed to being excluded from other things, it's not easy to access those things because not just because of language barriers and work schedules and things like that, but because when you're accustomed to not being eligible for things, it's complicated to even just know what you're eligible for and what you're not eligible for. And so it happens to a lot of people that it's just too confusing and overwhelming. And so people just assume that they're not eligible for anything, or sometimes they're even given, quite frankly, incorrect legal advice about what they're eligible for. So that happens to a lot of undocumented people that even though they're seeking asylum, which is not the same as seeking to become a citizen through family. And so the public charge rule doesn't apply to people who are seeking asylum, but a lot of people don't know that. And like I said, even some lawyers might be taking advantage and, giving them incorrect advice. So these are the kinds of things that happen to the most vulnerable people who live in our state and country. And I hope that as you go forward and make policy recommendations about universal basic income, that you will be adamant that it only proceed if it includes everyone who lives in the state of Maine. Thank you.
Thank you for joining us today, Elizabeth. And you mentioned that you weren't sure if you had said everything that you wanted to say. And I just want to invite you, and you may not have the time given your partner's medical challenges, but invite you and anyone who is listening on YouTube, please feel free to submit written comments to the committee on the feasibility of universal basic income. You can do that by emailing our analyst, Karen Nadu, It's karen.nadeau, NADEAU, @legislature.maine.gov. And folks can look at the Basic Income Security Study site on the legislature's webpage to review that testimony. A substantial amount of testimony was submitted in writing, and that link is legislature.maine.gov/basic-income-security-study. So Elizabeth, thank you. Are there any questions from any members of the committee? I see Sass Liniken's hand is raised. Sass?
Hi, Elizabeth. Thank you for that. I know you're going through a lot. Really appreciate you being here and sharing all of that. I really particularly appreciated you talking about procedural violence. And I know that you've had a lot of experience, particularly over the last few months, helping people to navigate accessing general assistance. And that is like pretty specifically for emergencies. And I was just wondering if you could talk a little bit about who is able to access that program and who isn't, and also whether or not you find the process of getting people hooked up with it to be straightforward and responsive. And if not, if you could speak a little bit more specifically about like what the actual barriers are to accessing that emergency help.
Sure. So with general assistance, my understanding is that basically this is state funding that's administered by cities and towns, and that prior to the pandemic, people would have to go in person to the city or town office to apply. I can imagine that that would be an extreme barrier for people, for example, in both urban and rural settings, but in terms of rural Maine, just thinking about how people often don't have reliable transportation, and they might be like very far from that physical office. So in terms of the pandemic, I guess I just want to be clear that one of the barriers is transportation. Even though that most of my time helping people with general assistance has been since March. But I just want to say that I can't imagine the additional barrier prior to March in terms of not being able to just call in to do the application. So that is something that I would hope this committee or other relevant committees would advocate around, is making sure that even when the emergency order is over, that people are still able to apply for general assistance by phone. And then the other barrier being time, the time frame in which general assistance administrators have to respond to requests. So I know that 24 hours might seem good in terms of emergency assistance. And again, my understanding is that prior to the pandemic, that may not have been the way the rule was. So that is just something I would emphasize, that even after the emergency order, there should continue to be rapid response. And I would actually prefer a rule, given that a lot of general assistance requests have to do with time sensitive things. I would prefer a rule that was not 24 hours, but rather, assured someone if they made a request during the day that they would get housing that night. I mean, that's really how that should work. There should be like at least, for example, a 1-day approval of emergency housing. And then you could use the next business day to sort out what would happen after that. So the comments that I'm giving so far, I'm getting to a direct response to your question, Sass, but are reflective of the barriers that I've noticed, right? And so I think that, first of all right, people don't know how to access general assistance. So I guess what I would say is that we need like mass public education campaigns, and that should be the responsibility of the state to do that, and cities and towns to promote how to access general assistance. I had to work hard just to find the direct line at the state, so that I could call when the city or town was not being responsive within 24 hours. It shouldn't be hard. That should just be like plastered everywhere. I know that might sound not good to some people, but we're talking about serious things, that people don't have food, they don't have a place to stay, they don't have the medicine they need. So the first problem that people have is like knowing how to even get, know the phone number to call, right? So cities and towns should have to publicize that, and the state should have to publicize the state number too. So, right, the way it usually works is that someone is in crisis in terms of especially housing, and then someone else tells them about GA. And then usually what would happen is they would give them the website. That doesn't necessarily work that well because if people especially are in mental health crisis, they're not really able to like look through the website and like what are the rules and who exactly do you call and everything. So usually I would be navigating that for people. So I guess I'm trying to think about like barriers at the same time as solutions, which is not what you asked me to do, but so the barrier would be like complex information buried on different parts of websites. With COVID, usually there's like a COVID section, like so the city or town still has the same old rules about how to access GA on their website, but you have to go to the COVID-19 section of their website to know how to access GA right now. So that can cause confusion and miscommunication. Honestly, even the fact that GA is just administered by cities and towns is basically creating a lot of variety and people having to know different numbers to call, etc. So I would say that's a pretty huge barrier, especially when you talk about like people who are experiencing homelessness. That means they're going to be moving from one city or town to another, probably just following whatever resources they have or rides they have or whatever crisis is happening in their life. And so I don't know the history of GA in Maine, but perhaps there was a time when it wasn't administered by cities and towns. I don't know. If I was going to have an efficient system, I would probably have it. I guess I should think before I say that, but I would consider having a more streamlined way of people applying. Maybe one number that you call that you then get connected to the right person in your city or town. So knowing how to apply is a huge barrier. Once you get to the part of actually reaching the person at the city or town, I guess I would say how city and town workers behave towards people is a barrier. There's often a lot of, I'm looking for the right word. In customer service, listening is very important, taking cues from people. There's kind of and I don't want to just call it customer service, but like when we interact with people, we can be like listening for what their needs are and kind of anticipating what's going to be the best way to interact with them, how to, just being responsive, right? I guess we could call this active listening, or I don't know exactly all the terms that I could use to describe it. But what I would say is the style of communication for most, not all, cities and towns, when they're on the phone with a GA applicant, I've done a lot of three-way calls with people to apply. I would say that 75% of the interactions are more like, you know, not necessarily rapid fire, but just perfunctory or not active listening, not, you know, sorry. Oh, even like I would say it's on a continuum, but I would say that maybe in at least 25% of the cases, workers are sort of like actively hostile to people, asking questions in a way that is, you know, appears to be sort of not helpful on purpose. Just, you know, my assessment of the situation as a third party. So that's a problem, right? Because especially for people who are in mental health crisis, that's not going to go well. It's going to make the conversation take longer. It's going to like put up barriers when there didn't need to be barriers. It's going to stress people out who already have past trauma interacting with these systems and make them not want to interact with them, which, you know, some of us would say might be the point. And you know, that's not good for public health. Public health is my field. And it's not good for public health if we're administering services in a way that makes people want to run in the other direction. Because as we say, an ounce of prevention is worth a pound of cure. And so it just means that we're going to have people who have increasingly more and more and more unmet needs, which become more and more complicated to, you know, address or meet the need. And I think we're already seeing that, you know, in our cities and towns, in our state, in our country. I guess I want to say in terms of barriers that I don't know, I haven't found the right language quite for this yet, but like I have worked with a few people. Sorry, my partner's on a call for telehealth. I've worked with a few people who I'm like, I need my headphones. 1 second. Do you need me?
Yeah, I was wondering if you can.
Oh, give me a second, please. Sorry. So I would say that I've worked with a handful of people who are like, have so much fallen through the cracks of that it's like almost like every system avoids working with them because they're hard to work with, basically, is one way to say that. And I feel like there needs to be some kind of program for like low, no barrier ways of working with people. I would say it's probably only 5% of the people I've helped, maybe, or maybe even 1%. But I would say it's taken up like maybe 20% of the time that I've spent helping people. So I just want to flag that, I guess, as an aside, which is like there are people for whom it is like intensely hard to access services. It might have to do with some specific mental health diagnoses. I don't know. That's not really my field, but yeah, it's and a lot of other services is when people are in that category. And it's probably not just taken up quote unquote my time, but like maybe across a lot of systems. And so it would be more humane, which is always the first reason, and more efficient if we actually had proactive systems to work with people who are, I don't know the right way, but like in multiple forms of crises and just very hard to connect with, I guess. Okay, let me make sure. Barriers to general assistance. So documentation. So often, you know, you were talking about people who are in crisis, maybe mental health crisis, might not have their stuff with them, their documents, etc. And they're being asked to provide documentation of like their income or something. which usually they don't have income, or perhaps one person has disability, for example. But this is actually something I've experienced in interacting with DHHS as well, where, it's, DHHS wants the person to provide, for example, documentation of unemployment. And it's just interesting, I guess that's the word I'm going to give it. There's other words that would be better, that people put the burden of documentation on the person on the individual who's seeking help and who's most in crisis, when the actual documentation that the city or town or state is seeking is actually produced by the city or town or state, right? So, for example, in my experience, DHHS wants people to provide documentation of unemployment income, but Department of Labor is part of the same state of Maine that Department of Health and Human Services is. So one could argue that it would be more efficient and accurate to get Department of Labor information direct from the Department of Labor, but instead the burden is put on the individual to provide that documentation. But in the case of general assistance, I think the most frequent example is just like documenting disability income. And I just imagine, I guess I won't go into ways I would solve that, but I certainly feel that there would be lower barrier ways to do that. Barriers to general assistance.
So thank you, Elizabeth. And I think that you've covered a lot of that. I think when we're looking at, I think we want to stay a little bit focused on the idea of universal basic income as a replacement or enhancement or a supplement to what currently exists. So yeah, thank you.
Yeah, no, and I do understand that. I think, I guess the applicability here is for people to understand how hard it is to access general assistance, so that they could really understand the value that universal basic income would be providing. Because I think for people who haven't had to access these systems, there might be a sense of like, well, it must be easy. You know what I mean? Or, it must be not too bad, right? No, it's horrible. Like, I shouldn't laugh when I say that, but it's really, really bad. It takes hours of time from people at a moment when they don't even know where they're going to sleep that night. I mean, I think it would be good for everyone on the committee to stop and think about how you would feel, which it's probably hard to do if you haven't been in that experience. But like, if you literally didn't know where you were going to sleep that night, or how you were going to get food, or how you were going to get medicine, the reality is that most of us have the privilege of never having been in that situation, right? But we really have to think about how destabilizing that would be, to feel all those feelings and at the same time be asked to do like complex cognitive and social skills, right, to get what we need. So poor people are amazing because they find ways to do this all the time, right, at a cost, right, at a cost to everyone's mental and physical health. But poor people don't get any of the respect they deserve. The assumption is that they act out, and that they're unreasonable, and that they're difficult. Meanwhile, they're coping with things that middle and upper class people have never had to even think are going to happen to them. So it's so hard to understand I haven't even really experienced that. I've just accompanied people. And I've experienced small versions of it, but mostly I've just accompanied people who are experiencing that. And I would say even the vicarious trauma sucks. And that's nothing compared to people actually experiencing it. And then you're talking about people who've experienced this during childhood and then continuing into adulthood. Like, we should kind of be ashamed. I mean, we should. As when I say we, I mean as a state. People are dealing with so much and we're having trouble responding. It should be very straightforward and quick. So thank you for listening.
Thank you very much for your time. We really deeply appreciate you being with us, especially given that your husband has some needs right now. So thank you. You're your partner. Thank you so much. Are there any other questions from the committee for Elizabeth? Okay.
I just wanted to clarify that line of questioning there, like, we are talking about basic income, but we're tasked also with looking at the efficiency and effectiveness of the existing programs. And I think in order to be able to talk about like the merits of unrestricted funding, for instance, it's important to understand what the impacts are when it's not unrestricted. And also, I just want to throw in a plug that I'm not looking to just replace these programs with a universal basic income. Because if it's universal across the board and everybody in the state gets it, and we replace public assistance with it, it's going to create a huge wealth gap.
Well, thank you for those comments, Sass, and we'll also have an opportunity to discuss further as a committee with each other what the goals of our report are, what the substance of our report is at our next meeting. Samarali, you had a question that you wanted to ask of Elizabeth.
Yes, Elizabeth, you said your background was public health, and I was wondering if you could quickly give us a thought frame on what the stress of poverty and those barriers actually means for the public health of Maine folk.
Yep. Thank you. Yeah. Yeah, so I studied public health at Columbia University. I have a master's in public health. My main mentor there was Mindy Fullylove. Mindy is a psychiatrist by training who studied the mental health effects of displacement, specifically on Black or African American communities all around the United States, but also just more generally, the effect of by displacement, meaning when people have to move, whether it's because of gentrification or a highway being built through their neighborhood or whatever crisis, right? So yeah, I mean, the public health effects of instability and poverty are tremendous. The first article that I read upon arriving at public health school was about the effects of poverty on poor health, going back before capitalism, going back a good, at least 2,000 years, all around the world. So I think that probably the best way for me to answer that question is in the context of what we're going through right now with the COVID pandemic. I think I will say that the number one killer of people in general, I believe, is heart disease. And I think there's a lot of ways that we could link heart disease to poverty. Obviously, it happens to everyone, but disproportionately to people who've experienced poverty. Obviously, with the COVID pandemic, we are seeing, it's interesting because we don't talk a lot about it in terms of poverty, right? We mostly talk about it in terms of racial disparity, which is highly connected to the disproportionate level of poverty that Black, Indigenous, and people of color experience in Maine and in our country and obviously around the world. But the racial disparities in terms of COVID are very intense, both in terms of cases and deaths. And that applies to both children and adults. And in terms of poverty, where I would say that we see that most affecting health and public health for people who work in what we call congregate living and working conditions. So people who have large families, people who have intergenerational families, people who double or triple up because of financial need or an inability to get a lease on their own, for example. Those would be examples of congregate living conditions. And when I say double or triple up, so for some people, that might mean many individuals who don't have blood or family relationships staying together. It could also mean several families, each family with a bedroom per se, in a 2 or 3 bedroom apartment. We find that a lot with the Latino community in Portland. And then in terms of congregate working conditions, working in factories, farm work, although some farm work happens outside, but some happens inside in terms of processing. So that's higher risk. And in terms of other indoor settings, obviously schools are a big indoor workplace setting right now. Not quite as concerned about workers there compared to meatpacking, seafood processing, those kind of employers. And the other thing we also talk about in terms of COVID and public health and poverty is congregate commuting or transportation situations. So the big races and for poor people, there's an economy to sharing, right? And often people don't have private vehicles or private homes or private spaces. And so people share transportation. And I don't mean just the bus, which would be a little bit larger and possibly a little bit safer in terms of ventilation. But I mean like cargo vans, 12-passenger vans, minivans. These are private transportation services that are being provided by friends or employers for groups of people to get to work or where other places they need to go. So I know that your question wasn't focused on COVID, Smarly, but I think that I'm trying to show how poverty affects the health of people who are poor, specifically in terms of risk for COVID-19 and spreading COVID-19. And what I was taught by my mentor, who I appreciate very much, Mindy Fully Love, was that the way epidemics work, for example, tuberculosis, HIV, etc., is that they hurt the people of what I would sort of call the bottom informally. So they hurt the most vulnerable people first. And then because we are an interconnected society, even when we might think we are not, what happens is that epidemics then spread out to affect everyone, even wealthy people. And unfortunately, what happens is because we value the lives of poor people less, we tend not to respond adequately to epidemics and to curb them among the most vulnerable people. And so then we experience them as a whole society. And then we tend not to respond enough until it's affecting wealthy people. And only then really in ways that actually are private oriented. And so then wealthy people benefit the most and poor people continue to struggle with the epidemic, which is basically HIV and tuberculosis. And it seems like that's the current path for COVID-19 as well.
Elizabeth, thank you so much. We really appreciate your public health background, and we really appreciate your time. I'm mindful that there are other people that want to testify about universal basic income. So I just, I apologize for cutting you off. We really appreciate the fact that you've taken the time to talk with us for about 40 minutes, which is amazing. Thank you. We really, really appreciate it. Are there any final burning questions for Elizabeth before we proceed to the next person here to testify? Okay, seeing none, thank you so much. We really do appreciate it, Elizabeth. And thank you for volunteering your time to help people get, it's pretty incredible that you're coordinating the response to needs that people have in the absence of adequate state supports to coordinate those responses. And the fact that you're doing it as a volunteer is an incredible service to the state. And to your point, is indicative of a failure on the state's part to meet those needs. So thank you for that work. The next person on our list is Larry Danzinger. We heard from Larry at our last meeting. Welcome back, Larry. We're really glad to have you today.
Well, actually, I submitted written testimony, and I think that should be adequate. So I'll just let's move on to the next person.
Before we let you go, Larry, are there any questions that anyone has for Larry? We do have the testimony. It's on the website for this committee, which is legislature.maine.gov/basic-income-security-study. Larry's is the third piece of testimony that's included here. And Larry, I did have a question for you. And that was, one, you suggested that we as a committee endorse the oops, I muted myself. I had a question for you, Larry. One, in your testimony, you recommend that the committee endorse the concept without necessarily filling in the details. Do you want to talk a little bit more about why you think that that is important?
Well, I think several, or at least a couple of people that already spoke, well, all three of them, I think, said that they thought it was more valuable to do direct cash payments than to focus entirely on benefit programs. And so if there is general agreement that that's a better approach, then I think it would be helpful for the committee to be able to say that publicly as a way to start the process, start people thinking about using direct cash payments in addition to, or in some cases where it's no longer where the benefits are no longer needed, instead of those benefit programs.
Thank you. And I had a second question just to surface this for members of the public who may be watching on YouTube. You suggested that a second action the committee could take is ask for funding either from the legislature or from private foundations and the public for a large-scale study to determine how direct cash payments can work, their long-term impact, and how they can be funded, as well as at least 2 to 3 pilot projects in the state that could provide those payments to every small town, every town resident, perhaps in a small rural town, to specific neighborhoods and or to means tested individuals.
I'm losing you again.
Sorry, do you want to share a little bit about that recommendation in terms of your recommendation that the legislature or that this committee recommend that the legislature commission a large scale study and pilot project?
Just as a first step or a first and second step in the process. If you think you have a good idea, how do you start to implement that idea? So this is a suggested way to do that.
Thank you. Are there other questions for Larry? I don't see any in the chat. Okay. Thank you, Larry. We really appreciate your time. At this point, I don't see any participants in the Zoom that are on the sign-up sheet. We originally had over 30 people sign up on the sign-up sheet to deliver testimony to the committee. We do have testimony that's come in and been shared on the website from 6 individuals, including 3 who spoke today, Diane, Clark and Danforth and Larry Danziger. We additionally have testimony from Evelyn Forget, Ginny Schneider, and Carol Wishcamper that is housed on that website, and I hope every member of the committee has a chance to read. I hope every member of the committee has a chance to read all that testimony if you haven't already. Is there anyone else who has not had the opportunity to speak who is in the Zoom meeting that I may have missed? Perhaps make a note of it in the chat. So if you are one of the 30 plus people who did sign up to submit testimony and you didn't get a chance to be in the Zoom, perhaps technology got in your way, or you didn't get the link in a timely way, or you had some confusion on how to join this meeting, please reach out to the committee. I think we could create some flexibility. If you had been signed up to testify today and there was some sort of technical glitch, I think we would want to accommodate you at our next meeting. Or the alternative to submit, as Larry did, in writing your comments is very helpful to the committee and creates part of that public record. So I'm going to just wait a minute or two in case someone is desperately trying to get into the Zoom a little bit late. I don't see that anyone is. So what I'd like to do is close the public comments portion of this meeting and then very briefly discuss our next steps. Let's go ahead. I don't have a gavel here in my living room. But let's go ahead and close the public comments of this meeting. But what I'd like to do, Karen, if you wanted to share with us what our schedule is for 2 future meetings and what our charge is to the legislature. So we are tasked with creating a report to the next legislature, and we are tasked with submitting that, I believe, by December. I think the deadline may have been November. But Karen, I'm going to let you lay out what our next steps are so that I don't make any error of fact.
Sure. So as you all should know, our next meeting will be 2 weeks from today, October 29, which is a Thursday at 10 a.m. And so this one will just be, it won't be a public hearing. It'll be an opportunity for study committee members to have a discussion about what should be included in the report. And it will be, from a Zoom technology standpoint, be much simpler. I will send you a link for a Zoom invite for the meeting. And because it's not a webinar, it's just a simple meeting, I'll be able to resend that to you. So we won't have to involve the IT folks as much. So, but there will be an opportunity, you know, there'll be audio broadcast. I'm not sure about YouTube, but there'll be an opportunity for the public to certainly listen to those deliberations. And then we talked about having a meeting at the beginning of November, although the date wasn't as certain, but I'll follow up with you and Representative Handy on firming up that date. Technically in the authorizing legislation, the due date is November 4th, but I think we're fine as long as it's sometime in the month of November. We'll be fine. And so again, the purpose of the 3rd meeting in November is really just to finalize the report. So Deirdre and I would have a draft for you to review and discuss, and that meeting would be just to finalize what's included in the report. So anything I'm missing?
No, I think that's excellent. For people who are new to study committees, so the report is exactly that. So we're not writing legislation, but we may make recommendations. And those recommendations can be as simple as Larry Danziger suggested. It can be an affirmative statement of philosophical support for the concept of universal basic income. It can be a report of the barriers that were identified for existing social services programs. It can be a recommendation for funding for a broader study or pilot program. It could also, not everyone on the committee has to agree. So we'll try in our next meeting to reach consensus about what we'd like to see included in the report. And if we can get to yes, and everyone on the committee can endorse a unified set of recommendations, those would have the strength of unity in terms of the legislature taking those recommendations and potentially translating them into a bill or into action. But if people have very strongly held beliefs that are different from other committee members, Karen, am I right that there can be a minority report? So the report can outline that this group recommends this and this group feels this. So that's also a piece of what's allowable. So I think what's incumbent for all of us over the next 2 weeks before the next meeting is to take the time to read all of that testimony as thoroughly as possible. If there are research questions that you have, for example, I mean, we don't have a lot of time for research or a lot of capacity for research, but if something that was said raises a question for you, that if it were possible to bring information or data to the next meeting, you would like that as a committee member, you should feel free to, let the analysts know if there's a piece of information, not like a huge scale study per se, but if you wanted DHHS to let us know what the utilization of SNAP is, for example, we could certainly send a note to DHHS to try to find that information out. Just giving that as a hypothetical. Any other questions or thoughts that people want to share before to make sure that you have what you need to get prepared for the next meeting? Representative Handy.
Thank you, Senator. And by the way, Senator, I think you did a marvelous job conducting this hearing over Zoom. With all our glitches, you made us shine. So thank you very much. I'm really interested to find out whether or not there's ever been a study of coordination of all the assistance programs. Maybe there's in the legislative history there might be something, but because I think what we learned here is that there are some systemic issues that at some point someone needs to address.
Karen, is that something that you could see if it's in our archives or if that exists?
Yeah, I can submit that request to the law library. I could also ask my colleagues who staff Health and Human Services if they're, aware of anything like that.
Great. Samarali, you have a comment or question?
Would it be possible for us to just get a broad list of what all the income support programs that Maine offers are and kind of what they do? Like, here's, the program, here's who it helps, and just have that as a base to discuss off from next meeting.
And if we could add to that, who administers what program? Some much might be administered by DHHS, some might be agriculture and so forth.
That definitely sounds a little bit challenging. Karen and Deirdre, I'm looking at you. Do you have the time or the capacity to reach out to DHHS to see if that list exists or to do a little bit of gleaning of that list?
Certainly there's time to make the request, but, without knowing, I'm not sure on their end how much work that would entail, but we could at least make the request.
Interestingly enough, if it doesn't exist, you might also ask the HHS analyst that question as well. But if it doesn't exist, that might be something to surface in the report itself.
Yeah, because that would flag me as how are we supposed to discuss how these programs are working and how is the legislature itself, keeping these things, track of these things.
Yeah, great. Michael Howard and then Representative Meyer.
Just a couple of quick things. I didn't discover until I got an email recently from Karen that there's a lot of testimony that was submitted for the bill that created our committee. It's actually quite relevant to the work of the committee. So if we could just all take a look at that, or maybe if a link to that could be put on our webpage so we don't forget about it. And the second thing was, is it within our charge in the report we call for the extension of the time of this committee, because we were originally supposed to have several months to do this, and it's all been cut short. And now we're facing a deadline that was originally anticipated to be after multiple meetings. And I'm wondering if we could, rather than maybe give a charge to the legislature that might lead to creating another committee, if this committee, which already has the experience, could be given a new lease for a few more months to supervise a study or do any of the other things that we might want to recommend.
Karen, what's the legislative process for that? I know one of the things that's, yeah, is there a process for that, or is that not permissible under the rules?
So how it works is this committee will cease to exist once the 1/30th legislature is sworn in. But and by virtue of the report itself gives the legislature, whatever joint standing committee the leadership finds is the appropriate one of jurisdiction, gives them the authority to submit legislation based on the recommendations or findings in the report that's written in the authorizing legislation. It's a first regular session. It shouldn't really be a problem anyway, because it's not as sort of restricted as a second regular in terms of, you know, submitting legislation. So there is already built into the authorizing, the resolve that created this study committee, that any committee of jurisdiction, it could be Health and Human Services, Labor and Housing, Taxation, could submit a bill based on the findings of this report that you all will be submitting in November. Does that answer your question?
From, just to amplify from a process perspective, so what that means is the committee cannot exist after this legislature concludes its work and the next legislature convenes.
Right.
If there was a desire to have the committee with this constellation of members reconstituted, what that would require is a new study committee bill, which any committee that receives this report could initiate, or any legislator could initiate. And then it would be about prevailing upon the Senate president, the speaker, who would be a new speaker, and the governor to make the same appointments back to the committee, which it's very possible they would do. I don't believe anyone on this committee is who's representing the legislature. I don't believe anyone is term limited out, and I think that whoever the new speaker is likely to have some sympathies about continuity of work, but they don't have to. And it might take a while.
Yep, that's exactly right. And also, I did want to address another one of Professor Howard's comments or questions that I have posted on the study webpage, testimony relating to the bill, I forget, it was 1324, Senator Vitelli's bill. The testimony related to that legislation has been posted on the webpage, so you can find it there. As he said, there was a lot more detailed testimony that will be helpful, I think, to you for your deliberations for the next meeting.
There's also a document on that webpage, just to add what Karen said, that was a testimony overview. So it's not the full testimony of everybody, but it was sort of bulleted list of what all the proponents said. Generally, you know, if there was the same thing said multiple times, it's only on there once. So it's helpful to see the whole picture. And then the opponents, which I think there were none, and those that were neither for nor against. So that's a helpful, if you don't have the time to read through each piece, at least gives you an overview of the testimony that was done at LD 1324's hearing.
Representative Meyer.
Thank you, Senator. I would like to have some additional information about what's happening in Alaska. In reading through some of, in preparing for today, I saw reference to a program in Alaska where there is a monthly stipend based on, actually it was as a right of residency. So just a little bit more information on what's happening in Alaska around this issue. Thank you.
Deirdre and Karen, is that something you think you could prepare for us?
We can certainly look into it and do the best we can in 2
You
weeks.
both are amazing. To echo the comment in the chat, thank you for putting all this together for us and organizing us. Karen Anderson.
Okay, can you hear me?
We can.
Okay. So I just wanted to offer, if it would be useful in any way, a resource that we have at Goodwill of Northern New England, where our work is, even though people know us for our stores, those stores put people to work. And we work all across the state of Maine, helping people who have particularly big challenges to find work, to be able to not only find work, but earn a living wage. So we have created something that we've been using now for about 5 years that we call a stability calculator. And it is a way of measuring the people that we work with, you know, sort of where they land in these, it's either 12 or 15 different categories, and many of them are obvious. They have to do with hunger and living in poverty and having a home or not having a home, access to transportation, but there's a lot of them. And we've now collected data for several thousand people. And I think it might just reinforce a lot of what we heard today, but if it's sort of bogus and not helpful, I'll keep it to myself.
I think it would be helpful. I think if you wanted to share it, sort of circulate information about it and then talk about it at the next meeting, I think that would be helpful.
Okay, I'd be happy to. Thank you.
That reminded me, Carol Wishcamper submitted testimony about the experience in Mississippi that she and her husband have been involved with in creating the Magnolia Mothers Trust. It's a pilot program offering low-income African-American mothers $1,000 cash on a monthly basis for 12 months. And they have some research or some data coming out of that pilot program. She suggested that the executive director for that program might be available to join us via Zoom briefly. And I wonder if we might make a short amount of time at our next meeting just available to talk about the Mississippi experience and that pilot, if we want to think about or consider what a pilot might look like in Maine and what it might cost. Are there any objections to maybe making, okay, seeing none, we'll do that. And then Sass, you had a question or a comment?
Yeah, I feel like I just want to name out loud that Summarily and I were asked to join this committee due to the lived experience that we have interfacing with poverty, homelessness, navigating public assistance. And I think a lot of people, I know a lot of people that I spoke to were really glad that she and I made it onto the committee because they felt like they would have some representation. And we left the last meeting tasked with doing like a larger study. You know, we're being tasked with coming out of this saying, is this feasible or isn't it? And I would just like to name that the process of being on the committee thus far has not been an empowering process because I feel like, you know, there were a number of emails that went out to kind of try to move along that part of the process so that we could do our due diligence to have a report that robustly had actually looked at whether or not this was feasible, because there are real, you know, real world impacts. You know, we're talking about people without homes, Indigenous folks, Black folks, Brown folks, who all have a disproportionate interface with poverty. You know, poor folks in general, transgender people, undocumented folks, people on disability, people who are disenfranchised because they're living in rural areas, elderly folks, families who were already at risk for public health needs even before COVID. And now we've seen the worst racial disparities in the country. We watched as, you know, folks froze to death last year. And countless people are dealing with eviction while many have lost their jobs and have lost community support, childcare, medical services. Food security is on the rise. And we're, you know, this was not a time to be ignoring the viability of these kind of changes. And so I guess I really want to say that if you're tuned in and you're watching this, and particularly if you are somebody who is low income, please submit testimony, because if you felt like you were being represented on the committee due to me and Summarily being on it, I do not feel that was the case, because our emails went completely ignored repeatedly over and over again as we tried to move forward, at least getting that study done so that we could look at, like, in real, you know, because now we're talking about packing in all this stuff, and our next meeting is the 29th. So in 2 weeks, we're supposed to come back and kind of look at what we should have had months to do. And so I just really wanted to name that out loud, because on top of everything else, there was no training offered where we were made to understand procedural rules or who to be in touch with, even if we had questions. And as a result, like, I saw Carol Wishcamper's testimony, which was super helpful, I felt like, and I wanted to respond to her through email, but I didn't even know if I could. Because there was absolutely no training offered. So I just really want to say that out loud, because I don't think this is something to glaze over. And I think adding Summarily and I to this to give voice to people who are really impacted at this point now, you know, I think we're both coming out of it probably feeling fairly tokenized and feeling like it's a performative gesture, which is important to note, because there are real world impacts to poverty. And there are real world impacts that could be had by having unrestricted funding. And if we're not looking at it in its wholeness and really looking at what are the impacts if this isn't the case, and we're only talking about it through the framing of wage earners, you know, I mean, who are we doing it for? So I just want to say all of that.
Sass, thank you for your candor and your honesty. I do want to share that this is a specific process that's set out by the legislature. And so it's important that we're not engaged in non-public conversations about these issues. This has to be a public proceeding. So to your point about training, that is a point well taken, perhaps for the legislature as a whole. I certainly, prior to being elected to the legislature, participated in a number of committees as a public member. And you're right, we don't have a process for doing public training of new members, and that's certainly a process improvement that the legislature could make. But I hear you about, in terms of the study itself, we were not permitted by the legislative rules to commission a broad study of the sort that Larry is recommending in his testimony. That wasn't something that we had the funds to do or the authorization to do. So we were somewhat constrained by that. I do take responsibility as a chair for not scheduling this group earlier. There was a great deal of uncertainty in terms of what was permissible in terms of meetings that are required to be public during the pandemic. Things did grind to a halt. And to your point, in terms of people suffering and meeting their basic needs, I can't speak for all the legislators on this call, but I can speak for myself that I've been dealing with literally hundreds of constituent services requests, especially around unemployment. I chair the Labor and Housing Committee, and trying to get unemployment to work better for people when it was absolutely broken has been a real challenge. So I welcome your critical feedback. In terms of any member's position on the committee and whether you feel tokenized or not, I think one of the challenges about being on the committee and the structure of the committee process is we welcome public comment to come in, and then we do the work session discussions. And that's, legislators ourselves, when we're doing public hearings on issues that we're really passionate about, our job during the public comment period is to really listen and take in information. And then usually in the subsequent sessions, that's where we have the opportunity to bring our own expertise into the room and engage in those discussions. So if you feel that you haven't had a chance to speak in terms of one, if there is substance in your emails that you want to bring to this group in a public way, I invite you to absolutely do that at the October 29th meeting to share your expertise and your lived experiences. And also, I would just finally say, I hope that nobody will make any assumptions about people's lived experiences in this room, this Zoom room, because I'm really glad that you are representing people with lived experience. I too have lived experience. So I just want to make sure that people don't make assumptions about people's backgrounds or where we all come from.
Just to clarify, I wasn't feeling that my voice wasn't heard in terms of bringing expertise. It was that we were tasked with doing a study on, we left the last meeting saying, okay, let's do this study to aggregate data. And then I emailed repeatedly asking about how we can fund the study because there was already footwork having been done. And I'm hearing you say that there wasn't funding for it. And there was an offer being made that there are some footsteps being made already to get funding, and was just completely ignored. So this isn't about feeling like my expertise wasn't brought in. It's feeling like my voice was not being listened to by power holders. Because while there may be other people on this committee who have lived experience, and I have no doubt about that, poverty is quite prevalent, and especially in Maine. Summarily and I were brought onto this committee specifically as those people. So having the people who have the answers, for instance, you telling me that, there was no, we weren't allowed to do something. I was asking those questions through email over and over again. And because of not getting any answer whatsoever, that's what I mean when I say, if you are somebody who is feeling like you are going to be heard, through Summarily and I, that just isn't what occurred, because as we tried to move that work forward and be heard by folks who understood the process and what it just didn't occur.
So just to clarify or amplify what I was trying to say, we weren't permitted by our authorizing legislation to accept money for the study. So at our last meeting, we did agree we wanted to do a study. And I introduced legislation, emergency legislation in the emergency session to authorize us to receive funding to do that study. And that was one of the bills that was on the table, unfortunately, when we adjourned under the emergency adjournment in March. And so part of the uncertainty was I had an expectation that we would return to pass those bills this summer. I voted twice to do so. I know other members of this body who are on the legislature did as well, but the legislature didn't reconvene. And so without passage of that bill, the process, the legislative process, which I understand is cumbersome and very structured, but we were not permitted to accept money to do that study. So Deirdre, do you want to amplify or explain anything that I might have missed about that bill or that process of accepting funds from the private sector to do this sort of work?
No, I think you covered it. It was, you did a joint order through the Labor and Housing Committee to report out a bill to do that, it would amend the resolve to allow that funding to be used for a greater study and to hire somebody else to aggregate all that stuff that we had talked about at the last meeting. And that got past the joint order, but we were never able to report out the bill because session pretty much ended the day that joint order passed. And so it kind of bound the hands a little bit to what you had decided last session, because just the committee didn't have the authority to do what they had planned to without that language being passed by the legislature as a whole.
And Senator Bellows, I'd like to put my chime in now, I guess.
Sure, absolutely.
I think most of the tokenizing feeling comes from the radio silence and responses. I think if that had been articulated in email to us when we had those questions of like, this just wasn't able to be done because of XYZ, we'll make sure it's on the agenda next time. That's the piece that we're talking about. The radio silence kind of comes in and tells us that we're not worth a response or answer. So it just makes it so it feels, tokenizing, and just that we're holding a space as opposed to being active members and having access to that information, because we're not internally in the legislature, so we don't have that internal knowledge, and we haven't had the training, so we don't know the knowledge of how the system itself is working. So whether or not it was an intentional impact, the impact fell down on us because we didn't have the access to the resources of information of how the internal process works, what our position of power was onto the committee itself, and how that was delegated down through.
Thank you for clarifying that. And I apologize. I take full responsibility. It wasn't my intent, but I hear you about it being the impact. And I apologize for that. Are there any other questions, pieces of information people would like, or things people would like to, and just again, in terms of inclusivity, in terms of responding to emails, I apologize for not responding to individual members, but we cannot have group conversations aside from process conversations. We can't have substantive conversations that are not transparent or that are outside of public view. I take that responsibility perhaps too seriously because of my background with the ACLU. So I take full responsibility for not sharing the process information that people needed, and I apologize for that. It was not intentional. Part of it was the uncertainty about what was happening, what was going to happen, and whether the legislature would be back or not. But in terms of email communications, I'm not going to engage in a substantive conversation about this sort of work. But are there any other, and in terms of process, yes, Karen and Deirdre are always available to answer process questions to the extent that they have information. So if there's something that you don't understand about the process or about what we're authorized to do as a committee or what you're authorized to do as committee members, please feel free and empowered to ask Karen or Deirdre. Any other requests for information or points of discussion for the next meeting? Okay, I do want to say I appreciate people's willingness to have difficult conversations, and I also appreciate the fact that everyone is participating in this. I think that the pandemic has demonstrated how broken so many of our systems are, and I've been working specifically on access to food and on unemployment, but I think what we heard today about general assistance, what we know about some of the thresholds for eligibility around and access to housing and what's coming with in terms of evictions. I think that the work that this committee is doing and the thinking that we put into it is an important building block. And Larry Denziger said it in his testimony, it's just a first step. This is by its nature, the legislature by its nature is a slow body, but I think it's important that we start to have these conversations in a public way and in a serious way, and that we participate in putting forward some really quality recommendations in our report so that the next legislature will take those seriously and so that we can continue to advance the issue. So I do want to thank everyone for their time this morning, for their thoughtfulness, for their willingness to do the hard work of individual research and reading in preparation for our next meeting. Our next meeting will be a discussion amongst ourselves of what we want the next legislature to do, what we want to make sure to include that's documented and that advances our collective goals that are written out in our charges. So thank you everyone for your participation. Representative Handy, you look like you want to say something.
I want to echo your remarks, Senator, and going forward, I look forward to the discussions that we'll have. I just want to say for myself, I learned so much from all of you on the real life experience. I thought I had a grasp of what it was all about, but I've come to realize that it's what I know is only minuscule compared to what you've shared today alone. So thank you. I move we adjourn, Madam Chair.
Is there a second?
I'll second that.
Okay, all in favor?
Aye.
Aye. Okay, we'll see you on October 29th. Thank you, everyone. Take care. Bye-bye.
Bye, everybody.